So hi, Dave Branch.
Hey, nice to meet you.
Nice to meet you, Jamie. So you're here. You're interested in something for your tummy?
Yes. Yeah. 3 babies.
3 babies, big ones, or
Yeah, they're pretty good sized.
yeah. Oh, good. Well, I'm sure they're healthy.
Yes.
All right. So you have some problems with. Did you have a C-section or regular?
Nope, I had vaginal births, but some stretch marks and some loose skin.
Okay. So let me go ahead and give you my spiel then. So tummy tuck surgeries, there's a variety, starting from the least invasive that accomplishes the least, all the way to the most invasive that can accomplish the most. So starting with the mini abdominoplasty, that's where we're removing some skin from below the belly button. Usually we try to keep it as low as we can. So we're usually taking out like a C-section scar if you had one. And then sometimes we're combining that with some liposuctioning. Sometimes people don't need the liposuctioning, but it's just to sort of tighten up the lower abdominal skin. It sometimes can pull the belly button down a little bit and create a little bit more of a hood on the top of the belly button. So not everybody's a candidate for that, but certainly there are a few. So the next iteration would be a full abdominoplasty, and that's where we're taking all of the skin from the pubis or the C-section scar all the way up to the belly button. And depending on how long that distance is, kind of determines the length of the incision as it goes kind of around your hips there. Some people have a short distance and they don't need as long of an incision, and some people have a longer distance and need it to sort of wrap around. So for that operation, the full abdominoplasty, everything is gone below the belly button. So now everything above the belly button now is stretched out over the belly button and takes the place of the lower abdominal skin. And while unfurling itself in the upper abdomen. So it tightens the upper and the lower belly. And then I bring the belly button back out through a separate incision. So it stays in the same location, just comes out through different skin. So oftentimes that's combined with some liposuctioning of the waistline, and then oftentimes of the flanks too, because oftentimes when you close an abdominoplasty, it's sort of tight in the front, but it's just as loose on the sides. And so to prevent that from protruding, we usually do some liposuctioning there on the sides as well. And then some patients also have laxity of their muscle fascia. The fascia is like the skin over the muscle. And it starts off real strong, but if you've had a lot of weight changes or pregnancies, you can get stretch marks actually in the fascia, just like you can get it in the skin. And then when that happens, that fascia that sort of holds the muscle tightly vertical against your intestines, it loses some of its strength. And then so your intestinal contents, your abdominal contents, can sort of push out against your abdominal wall. The muscle doesn't have the fascial support anymore. And so it can sort of give you that maybe 3-month pregnancy look kind of forever. And so some patients will have me tighten up the fascia. So I'm usually doing a pleat and tightening up the fascia, pushes the belly kind of in and back, makes it so that when you cough, when you sneeze, when you laugh, when you bear down, it's a lot more uncomfortable than if I had left that layer alone. And you also have a weightlifting restriction for 3 months of 20 pounds, which you wouldn't have if I left that layer alone. It probably adds over 50% of your pain, probably 70% of your pain to do those plications compared to if I'm just doing skin and then doing some liposuctioning. Okay. So then beyond the full abdominoplasty is the extended abdominoplasty, where I extend the incision all the way to the table. And then I'm tightening up the skin on the side so that when you wear a belt or an elastic, because I've emptied some of that skin, it won't be looser now and lap over your belt line. Does that make sense? So we're sort of tightening up that. So then the final iteration beyond the extended abdominoplasty is the full circumferential body lift. And that's basically where I'm doing, I'm taking skin, a fair amount of skin from the lateral aspect here, much more than just the extended abdominoplasty. And so it actually pulls up on the lateral thigh. So folks that have lost weight or they have this sort of bucket handling over the hip bones out there, those patients really benefit a lot from the circumferential, because I can fix sort of the lateral thigh skin redundancy. And then that incision goes all the way to the back to the top of the gluteal cleft, your bottom crease there. So with some patients, I will take the love handle tissue if they have really flattened buttocks, and I can rotate that into the buttocks to give more fullness. Other folks just want that gone. But it does a great job of the lateral thighs. It helps lift the bottom a little bit, and it also helps, you can add some volume in there. So that's a longer procedure. That's usually done by itself with nothing else, because I'm doing the back first, and then once the back is closed, we turn over, and then we basically do the abdominoplasty and reconnect to the incision from the back. And that takes, the better part of a cosmetic day. We try to limit it to under 6 hours for anything cosmetic at the hospital, and really under 4 or 5 hours for anything cosmetic here in the office OR. So let's see, questions?
Yeah, I might have a hernia on my belly button.
So that's pretty common. And so hernias around the belly button, a lot of people have them all their life, and they're never symptomatic because a little piece of fat that's in front of your intestines gets stuck in it, and it kind of plugs it and protects it from, your intestine getting stuck in it, which then, if that happens, that can be, an emergency and needs you to have emergency surgery. So oftentimes when I'm doing the plications, I'm sort of plicating back that hernia. Sometimes I'm also separately fixing it and then plicating it back. I mean, when I say plicating it back, meaning if the belly button is here and the hernia is right around the belly button, I'm doing a pleat for the plications, like we talked about, for that laxity. And so I'm bringing, this part of the fascia and this part of the fascia together in the middle, and then the hernia is kind of imbricated, is what we use as a surgical term, so that it should no longer really be a problem. So I do that. And then once again, if I just do the hernia repair, it would also have that 20-pound lifting restriction for about 3 months. If I don't do the fascial plications, which I would say I don't do more often than I do them, then you have really a 2-week restriction to prevent bleeding. So no lifting, no straining, no exercise, just keeping your blood pressure low, avoiding the blood thinners for those 2 weeks. And then after the 2 weeks, you can start lifting more. And then in terms of like aerobic exercise, we're getting your heart rate up. Then that kind of is determined by the drains. So I do use abdominal drains, and so those usually come out between 1 and 3 weeks. And then we see you back a week after the drain are out to make sure you haven't accumulated any fluid. So I can do the drainless abdominoplasty procedure, and I've done it in the past. That's where you basically are sewing the undersurface of your skin down to the fascia. The only problem with that is, you're getting rid of the drains, which allows people to shower earlier, but now you've sort of tethered that skin to your muscle fascia, and that skin's supposed to be mobile. When you lean way back or you lean way forward, that skin slides over your fascia. And so by adding sutures and securing it there in little points, I think down the road, if a patient stretches and leans back, you're going to get little dimples where those little sutures are. So I think that ultimately things look better with the drains because it allows that natural reconnection to occur between the skin and the fascia. That is a slidey kind of connection and not a focally stuck connection. Does that make sense?
Yeah.
But so, yeah, the drains are what people hate the most, just because they prevent you from showering and stuff, but usually they come out uneventfully in the office. Trying to think what else there is. So I do use a binder. So if I've done any liposuctioning, then I'm going to usually recommend a compression garment. So we use a bandeau garment that's Velcroed. And then usually I have people switch pretty soon to a double layer of Spanx or another compression garment that works well for them. I think those garments give the best compression down low in the Mons area where a lot of the swelling persists. The swelling will persist no matter what technique you do, will be coming and going a lot for the first 3 to 6 months, and then not very much for the next 6 months, but nevertheless a little bit.
How long did you say I had to wear the binder?
So in the summer, we were lucky to get 6 weeks out of folks. In the winter, we try to get 2 to 3 months. And it's, you don't have to wear it at night after 2 weeks. So it's just for when you're up and around. So you're good? No other questions?
No, I think I'm good.
All right. Well, it was my pleasure.
All right. Thank you.
Yep. Take care.